Carpal tunnel surgery is one of the most common surgeries done by a hand surgeon, and it consists of relieving pressure off the nerve in the hand or going to the hand. So the median nerve is a nerve that comes right up through the palm and gives feeling into the thumb and the index and long finger and actually part of the ring finger. And carpal tunnel syndrome is when there's an increased pressure around that nerve, and that pressure can cause either pain and usually with that pain, numbness into that area of the hand. So patients who are good candidates for carpal tunnel surgery are patients who we know have carpal tunnel syndrome and who have had it for long enough that it probably won't go away on its own. Sometimes carpal tunnel syndrome will come on after increased activity, and sometimes it'll come on after changes in somebody's condition. Probably the most common condition that it comes on in is pregnancy. So if someone's pregnant and they get carpal tunnel syndrome, but then it goes away after they deliver the baby, that's somebody who doesn't need carpal tunnel surgery. But for most people, it comes on and is quite bothersome. One of the hallmarks of carpal tunnel syndrome is that someone will awaken with their hand feeling numb or dead. They'll describe shaking their hand out. Sometimes braces is enough, but wearing a brace on the hand is enough to have that go away. So again, that's someone who doesn't need to have the surgery. But if a patient's had the syndrome for a while, if they tried things like braces, they've tried maybe changing the position of their hands when they do certain activities, and it still bothers them regularly, that person is usually a pretty good candidate for surgery. Usually, to make sure someone's a good candidate for surgery, we'll get a nerve test to see the quality of the electricity going across the wrist. And if that shows a real severe carpal tunnel syndrome, that usually leads us to recommend surgery more definitively. If it's very mild and the symptoms are intermittent, sometimes we'll just watch that. So again, it goes back to how severe the condition is and how long it's been there, and if the patient has tried things to get it to go away on its own. Of all the things we do for carpal tunnel, science or the literature shows us about the only thing that definitively or definitely removes the carpal tunnel syndrome is to do carpal tunnel surgery. So in the right patient, it's a good option.